Hello, and welcome to Timing is Everything, a program of Care Dimensions. My name is Mary Crowe, Education Specialist at Care Dimensions. Today, we have the good fortune of having Pam Kuras and Nancy Davan on, who are licensed massage therapists on the program, and they're going to talk about the benefits of massage, but also the benefits of massage with individuals who are at end of life and their families. Welcome to the show, ladies.
Thank you.
Happy to have you here.
Thank you.
So tell us a little bit about yourself, your role at Care Dimensions, and also tell us a little bit about yourself. Pam, if you want to start.
Sure, thank you. Hi, I'm one of the massage therapists at Care Dimensions. We have, fortunately now, we have quite a few. I started many years ago doing senior massage, and that's what got me interested in hospice massage. And one thing led to another. I did a rotation during my training with seniors. I ended up, because I liked seniors so much, I did chair massage at a senior center for many years. My personal clients were seniors, and it seemed to be sort of a natural transition to volunteer at Care Dimensions when they started a volunteer massage program. And from there, I was hired in as the first massage therapist in the program.
Oh, that's
great. So I was
great.
honored to be selected to do that.
Oh, that's wonderful. So you've been doing this a number of years for Care Dimensions.
It's been 8 years totally.
That's wonderful.
Yeah.
Wonderful.
And it's been a wonderful experience all the way through.
That's excellent. Well, that's super. Nancy, how about you?
Well, I've been with Care Dimensions for about 6 years, and I've been a massage therapist for about 10. But I have 30 years of hardcore business in advertising. I took a package and I ran. And I ran and I found myself in massage school. So as cliche as it sounds, I had a calling. In the middle of the night, I put myself on the layoff list. What am I going to do? What was I thinking? Turn on the TV, go to massage school, go to massage school. So what did I end up doing? I went to massage school. So for a year, I dove in deep and I became a body junkie. I was so enamored with how we worked, how we operated. I had no idea. And then from there, I graduated and I was working in these spas going, this is ridiculous, this is not what I had signed up for. But through patience and timing and video, web jobs and things like that, came up this opportunity of working with Care Dimensions and doing some cancer work as well. And I dove deeply into both. And from there, the journey just continued on, and here I am.
Oh, that's wonderful.
6 years later. Yeah.
I always say that we don't pick our professions, they pick us, and certainly anybody doing any type of hospice work, I truly believe it is a calling, that it's definitely not a job, it's a calling.
Oh, yeah.
So that's wonderful. So tell us let's talk about massage. Let's talk about the benefits of massage. Again, you can both, give your perspectives on this,
Sure.
but, Pam, if you want to go first, just, give us the general benefits of massage, and then we'll kind of get into it a little deeper in terms of how that differs for people with an advanced illness.
Sure. Well, massage is great for when you start with the body, for the muscles. So many of us are running around. We have such busy lives. We are tense all the time. We see a lot of people with shoulders up in their necks. Tight muscles, it's good for circulation. It's good for relaxation. It's good to just take an hour and a half of time and get away from everything, relax, get all the kinks worked out, just take a little time for oneself. It's a good time to just stop. And for most people, almost everybody that I saw in my private practice had some kind of muscular issue. People have sciatica, stiff necks, shoulder tension. Massage covers a wide range of, can help a wide range of muscular and connective tissue issues. But the relaxation part of it is really, really important. Stress relief. It can enable people to just emotionally kind of let go just for a little bit of time. And I think we all need that, and we very rarely get it.
Yeah, absolutely.
So in general, those are just a few of the things that regular massage can do.
That's wonderful.
So.
How about you, Nancy?
Well, definitely the circulation benefits highly. I have a medical massage certification, so I do a lot of cranial work, headaches. So I've discovered, how to deal with whether it's sinus headaches or cluster headaches, whether it's fibromyalgia, whether they're a diabetic, whether it's sciatic, whether it's, or if it's sports or things like that. So I'm able to bring to these people a little bit of relief. And it's, massage works the body from the outside in, so it's a bit of a process. And when they're on the table, you put them in what's called a tasmic state. And it's like they're not asleep, they're not awake, but they can kind of hear you, and they kind of like zone out. And when they're in that space, when you get them into that place, that is when benefits really start to occur, when they start to exhale and they start to reap the benefits.
It must be wonderful for you to see that, like in progress, when people come in and they're probably, again, and I think what you said, Pam, too, is like we don't take time, and I don't think we even realize how wound up we are in our lives, and then again, we'll talk in a minute about people with an advanced illness, which really ups that quite a bit in terms of just the overall stress, not just to the body, but to the spirit, the mind as well. So it's, it must be very refreshing for you to be able to watch people kind of, decompress in front of you.
Absolutely.
It must be a very rewarding feeling.
They come in onto my table. Quite a few of us have a private practice, and they'll come in all crunched up, and then they leave like, oh.
Yeah.
And that's how I know I did it was a good, good session.
Yeah, it's nice. Talk about too. Well, I just want to point out too, like in terms of massage. When you talked about seniors, you talked about, and really it's for any group, but just in terms of the power of touch too. There are many people that don't get touched, and that's quite a sad thing in terms of that. So I think there's just so many, again, different levels of this, spirit, mind, and body, which is what hospice really encompasses. And I think this is such a perfect match or fit to have massage in to encompass that, and just non-traditional types of interventions in these ways. This is part of the complementary therapies program, and again, how necessary this is.
Well, I was going to say, the integrity of the work for hospice as opposed to a sports massage, for instance, is very different. When you're working with someone with advanced illness, you have to be invited into their space. It's not, they come to us on Healthy Bodies, but we're going to them, and they have to truly invite us in. We have to know, they have to know why we're there, and that touch, the integrity of the touch is critical. Their skin is like rice paper. They're looking at us like with eyes of pools of water. They're looking through us. And we really have to be able to crack that, to be able to come in even that much closer and to be received in to make any sort of difference.
Absolutely.
In some cases, depending on what we're dealing with, because the plethora of diseases that we have, that we deal with, are just, it's ginormous.
And our seniors are not used to massage. This is a sort of a relatively new concept. People our age are used to complementary therapies, but someone who's 95, massage might mean something very different to them. And so for us, bringing touch to someone like that can sometimes be a revelation. For someone that hasn't been touched for a long time, maybe if someone has lost a spouse many, many years before, has lost friends, maybe a home. It's a time of great loss when someone is in their very advanced years. And so just very, very gentle touch. Sometimes it's almost like a laying on of hands. It can be a very, very healing experience on a lot of levels. And on the most, even on the most basic levels, the physical level, if you're sitting in a chair for 7 hours a day, 8 hours a day, if you're sitting in a wheelchair all day, your back is basically toast, and probably no one around you is even thinking of that. And so just even a little bit of gentle manipulation, bringing a little bit of blood in circulation can feel, it can sometimes brings tears to people's eyes. Because they're just used to being uncomfortable. And so, there's many, many ways in which, especially for our elderly patients, but, for patients with long-term illness, just that simple fact of touching even the back can be very, very powerful.
Well, like you say, I think just the very fact, though, that somebody recognizes, because like you say, people are so busy, and I don't think people are paying attention enough, and it's
Yeah.
not ill-intended.
No,
But not
no.
even recognizing the fact that this person might be sitting up, and again, what are the pains and the other issues that they
Right,
have,
right.
and people don't want to complain necessarily,
No,
so that we
no.
don't know it. So just to be able to be identified and to tune into somebody so clearly like that, it must be it's a wonderful thing, I'm sure.
It is.
Talk about the ways that, how is massage different when you're caring for people at end of life and their families? Because obviously there are some very different issues here. And you brought one up already, Nancy, which is this is a very, very, very personal time of life. And for people to let you in at this very special time is truly an honor. So talk just more about, again, what would be the differences between, again, people generally just coming in for, whether it be a therapeutic massage, but how is it different?
Well, it's actually very, very different. First of all, as Nancy said, when someone is seriously ill or is elderly and has never had a massage before, you are coming into someone's space. And so we have to bring a lot of, a tremendous amount of thought and compassion with us when we deal with that person. We have to be very careful about how we approach someone. We would like to honor that person. And so we do that to each individual to the best of our abilities by using our perception to basically figure out the best way to be respectful of that person in their space, in their person. And so we approach that person by asking that person what they need. We don't come in with our own agenda and impose an agenda upon them. We have so many different kinds of illnesses and so many different kinds of things to address that. And every person is so individual. That's the thing that we've learned, that there's no cookie cutters. There is no, we're not going in with I'm going to do an X kind of massage on this particular person. Every individual has their own sense of privacy, has their own sense of what they need. And so we approach them humbly, asking them how we can provide them with what they need. And we work with them. And that's a big difference because we're working with them through that whole time that we're with them.
I love that.
And we have to stay very present and when we're working on these people, because when I'm doing like a regular healthy body massage, I kind of get into the flow of the music and I'm just sort of doing what I'm supposed to be doing, and my mind is working. But when we're with our patients, we have to be 100% present and aware of even facial grimaces or facial relaxation, and those are our cues to keep doing or not doing what we should be doing. So that's a big part of it, I find, for myself. And say I'll typically see 5 Care Dimensions patients a day, roughly, depending on where I'm going, and it's way different. I can be as tired. Because I am, it's the work, the integrity of the work. It's, you have these little frail little bodies, and it was so focused that we're by the end of the day.
Well, like you say, when you're putting that much energy out, it must be a wonderful exhaustion, though, to know that you have really, again, to meet people where they're at. I love that you, again, find out from their perspective. Because when, and I do want to say, too, because, again, a lot of times, I don't want people thinking that hospice is really just about older adults, right? Because we know that we have people on service, even pediatric clients. So it really, unfortunately, advanced illness or end of life is not a respecter of age. So we have people of varying ages, but you have to really, it sounds like you have to really gear this towards the individual, which I love. But also, again, when people have an advanced illness, how much control do they feel? I love that you find out from them what's important, and us not make an assumption of what their needs are right then, because only they can tell us. So, what would be some of the things that they would say? Like, how do people gear it? Like, if you go in and you say to them, tell me what do you need? That sort of thing. Are people able to really? How do they
articulate?
Yeah.
They can. They usually will find a starting place.
Yes.
So maybe someone will say, you know, I'm really having a lot of, my shoulder is really hurting me.
Okay.
So maybe we'll start there. I will say, if say someone approaches me with a specific problem like that,
Yeah.
how about if we just rub the shoulder very gently and we'll see if that feels good
Yep.
or it doesn't feel good.
Yes.
And we'll take it from there. And we start in a place very gently.
Yep.
I have to emphasize that our massage is very gentle.
Yes.
There's no deep
Yes.
tissue. There's no manipulation of the muscle.
Sure.
What we're trying to do is very different than what we would do in a normal massage. We're maybe trying to fix a problem. Here
Right.
we're not trying to fix anything. We're trying to soothe and we're trying to comfort.
Yes.
And so if someone has pain, we will maybe massage that area very lightly. Tell me how you feel as we're going along. Does
Yeah.
that feel good? Is that okay?
Yep.
And then maybe we'll move down. Can I move down to your arm? Is it okay if I massage here? We
Yep.
constantly checking in. Is that
amazing.
okay?
Yeah.
How about your hands? And someone might say, oh no, I have a lot of arthritis in my hands.
Sure,
I
yeah.
don't want you to touch them.
Yeah.
Okay, can we move to your back? So the process is kind of organic and it's guided by the patient and how they're responding to what we're doing. And as we move along the body, we will ask them. And as Nancy says, there's also the nonverbal cues. If someone grimaces, you know, oh, that's a place to avoid.
Yes. Yeah.
Someone might have the paper thin skin, for example. There might be, of course, we don't massage anything that is bruised, anything that is open. Those are all contraindications.
Sure.
But any other area where we will go along with the patient as they guide us, and eventually, by the time we get to the end of the massage, we've covered pretty much everything that they would like us to cover. And sometimes, as we're going along, their reactions are guiding the process.
Yeah,
So
yeah.
they may end up with a full body massage when they started out with a shoulder pain.
Sure, sure.
And
Yeah.
and they love it
Yeah.
because they're in control of the process. They're in control.
Go ahead. Want to add to anything with that, Nancy?
Well, it's very frequent with edema in feet and legs, and
Yeah.
they'll just say, please just do my feet and legs because they'll be very full. And
Sure.
and that's kind of interesting because there you can see physical results.
Yes.
You know, but just by carefully moving the fluid, and
Yep.
there's no pressure. It's just a very fluid strokes, very consistent strokes, and you know, and they're like, wow, you know, they enjoy seeing that there is not that there's a chance, but that there's a movement, and they feel like a little bit lighter. I'll say, oh, can you pedal your feet a little bit more? Oh, I can pedal my feet. It just helps them to feel a little better.
Absolutely.
And then I can physically see
Yeah.
it. But sometimes the nurses will say, Nancy, while you're here, could you check this? Or you know, they're complaining of their shoulder or their elbow.
Sure.
So sometimes with the nurses' input, or they'll be in our clinical notes,
Yeah.
could you check to, you know, they have headaches or whatever, and we'll back it up with that.
I think that, you know, people don't understand sometimes that although, again, you know, when people have an advanced illness or their end of life, we might not be able to fix things, but there's a healing component to that as well, right? So if you can just speak to that for a minute, because again, sometimes we feel that, you know, people are at end of life, they're just waiting for this medical event to happen. It's so much more than that, and there's so much at this really very personal stage, and there's a lot of healing and personal growth that can happen. So do you want to just speak to that at all?
Sure. Go ahead.
Well, just the element of touch. Sometimes, you know, we'll have some of these patients, and I'll work with them for a minute, but then we'll just I'll take off my gloves and I'll hold their hands.
Yes.
You know, we wear our gloves when we do, but just holding hands for a minute and just kind of like a gentle, light chatter.
Yeah.
And you watch them exhale and you watch them smile, and then they get a little color in their cheeks, and you know that you've changed their day for just a little while, and
Yes.
that's huge.
Yeah. Is there a set time frame that you have, or does it vary amongst individuals? Like in terms of how long a massage is, or does that vary for the person?
I would say yes.
Yeah. So there's not you don't go in and say, oops, like, you know, like with a traditional massage, you have 30 minutes, you have 60. No, but it sounds like, again, you can be totally present with that person without having those those guidelines of somebody even having to say, oh my gosh, that's going to end.
Well, we do, technically they're hour blocks.
Yeah, yeah.
But there are some people that they're so frail they can't take an hour.
Right.
You know, you can do a whole little body, and that's way too much, because then they'll feel it the next day and even that's on the gentlest touch.
Sure.
Or some, I'll look at my watch and go, nuts, it's an hour and 10 minutes.
Yes.
Just because, and you kind of, I'm aware of that through the course of the day. You certainly don't want to, run into it becomes a bad domino game should you run late. But but to answer your question, we have to be flexible because it's what they can give us.
Sure, sure. Go ahead.
I just wanted to address the question you asked before about the sort of spiritual component.
Yes,
and I find that because we are in such an intimate relationship with our patients, we are in their space, we're touching their bodies, that many times patients will let their guard down with us, and they might do some life review, they might talk about things that are painful for them, things that sometimes they do a little bit of letting go while we're there. And the letting go is not just a physical letting go, it can be an emotional letting go, it can be just releasing in other ways. And we just let that be. We're present with them. We let them, sometimes patients will cry, or sometimes they will hug us, or we hug them. There's an emotional release that sometimes happens when you're doing massage, which is it's a wonderful thing, and it's very powerful. And I think that we witness a lot of things with our patients. We share sometimes things that are personal with them. Of course, that's just something that stays there, that is a powerful moment for that patient. And it just, sometimes the physical letting go enables them to let go in other ways too. And that's another way in which I think that massage and touch can be a very profound thing.
Well, this is such, like I said, this is such a very personal thing that you're doing.
It is.
So, it must be so nice for people to be able to allow themselves to be vulnerable and to feel like they're accepted and they're not being judged. And that, again, who they are and where they're at, again, and that they're cared for wherever that place is. And that must be a wonderful feeling for both of you.
Absolutely.
For you and for the individuals and the families too. Yeah. So what are some of the reactions that you get from patients and families around this?
Well, sometimes some of the most interesting, and this is like a side note thing, is like I'll ring the bell, and they'll answer, whether it's a caregiver, and they're looking behind me. Where's your table? I'm like, I beg your pardon? I thought you were bringing a table. And I said, no, it's not that kind of massage. Let me come in. I'll come in and I'll explain. And so that's been kind of an interesting situation. And because we work with patients, whether they're in their hospital beds or in their wheelchairs or in their recliner. I just couldn't imagine carrying my table. And some of them could, by all means, able to get on a table, but for the most part, they're, but for some reason that's something that they're expecting or wondering about.
But once again, meeting the person where they're at.
Exactly.
And that even means physical location or physical abilities or wherever that is. And I think some people might not even think that, again, from the traditional standpoint, geez, I can't even have a massage because I'm not able to get up on a table. But so this defies all of those misconceptions, doesn't it? That's wonderful. Why do you think that Care Dimensions feels like this is so important to have this type of service provided for patients and families?
Well, I think Care Dimensions is trying to present cutting-edge care. And with that comes the recognition that it's not just about, that there's many dimensions to a human being. And to bring comfort to a person means many things. It's not just nursing care. Although as important as nursing care is, there's more to it than that. And I think that Care Dimensions is attempting to address the human being on many different levels. And I think bringing touch therapy in and some of the other kinds of therapies, music therapy, pet therapy, that we see how moved people are by these experiences. In fact, right before I came here, the last patient I worked on before I came here had never had a massage before. It was someone who I think is a very low-income person, had never expected in his life to ever have a massage. He had a lot of edema, a lot of swelling, as Nancy mentioned. And he actually had tears in his eyes while he was trying to thank me. He said, I can't even tell you how much this means to me, and how, he said, this is healing. This is healing. And he said, I can't explain what that means, but that's what this is. And he was crying. And it was just a very powerful thing for him. And what he was trying to communicate to me, what great opportunity it was for him and how treasured he felt. He said, this is unbelievable. He meant the service, like the whole service. He goes, this is unbelievable. I never thought I would get this. And so it's very powerful for the patients, and it is for us too when we witness that. It's really a privilege to be there at those moments. These are very sacred and powerful moments in life. And we're privileged to be there. So. And to provide that for people.
That's wonderful. So. Did you want to add to that, Nancy?
Well, what I love so much about this is that our doctors in Care Dimensions consider us part of the team. We are, and they are, this was always like a struggle through the years with massage or all complementary therapies. And our doctors they believe in us. They have seen what we can do, and now we're part of the group, and that's huge.
Absolutely.
So that's a big part of it for me, is that.
Well, and like we said, a hospice again, a spirit, mind, and body. So I do love that about it. It really focuses on the whole person. And knowing if we don't address all facets of that individual, we're missing the boat. And that's a wonderful thing. You don't see that in all types of healthcare, do you? Yeah, and I do want people to understand too that this is of no charge for them. That they don't, that this does not cost them anything. This is a service that is provided through Care Dimensions. So, because people will ask that.
They do.
I know that we're going to need to wrap up in a minute or so, but let me just ask you both, what in the time that we have remaining, what would you like to share that you haven't been able to say so far with our viewing audience today about the work that you do, or how you're impacted, or how others are? Go ahead, Pam, would you like to start?
Sure. Well, it's hard to describe. Sometimes when things are kind of amorphous, it's hard to describe how much of an impact they can have. And I think with complementary therapies, with massage, with touch, with people, that touch is a very, very profound thing. And it's probably the most basic human thing. When people are born, their mothers hold them. And at the end of life, people go back to those earlier times in a sense. And that touch becomes as important as it was at the beginning. There's symmetry between the beginning and the end.
Sure.
And so giving someone that comfort at the end it's a very, very powerful thing. And it's a way to depart this life that it's so much easier to leave with comfort than it is to leave without. And we feel like we're part of that process of providing that. And so, again, it's a privilege, and it's very, I just feel full of gratefulness that I can be part of that. It's very, very rewarding for us. So we're very grateful.
And I know we're really running short, but I want you to have a last word, Nancy. So just for in a few seconds, if you can, just.
I have the best job ever, and I'm grateful every day that if I can make a difference and be on their journey, on these people as they're preparing to pass, the best job ever.
Wow, that's wonderful. Well, I can't thank you both enough for being here.
Thank you.
People are so lucky to have you. I know Care Dimensions is, but there's certainly the patients and families that we work with too. So thank you so much for all you do.
Thank you.
Thank you for having
me.
I'd like to thank everybody for tuning in today to Timing is Everything. And we will put up on the screen information where you can contact Care Dimensions, and for people that are on hospice services who can actually have massage therapy. So, but thanks again for tuning in, and look forward to having you at our next show. My name is Mary Crowe, Education Specialist.